So, Dr. Kenkel, there's been a bunch of craze by micro-influencers and celebrities talking about preventative Botox and just fillers in general. Can you kind of just talk about this phenomenon and whether there's any validity to it?
Sure. I think you have to be careful what you read on social media. I think there's this false impression that likes and patient views are consistent with tried and true outcomes. So I think you still need to do your homework if you're going to investigate doing some procedures. I do think there's some kind of hot areas right now. Prevention is something that I was a little apprehensive about initially, but I do think that there's some validity to it. The mainstays of that are going to be obviously good skincare, but then things like botulinum toxin to help weaken the muscles so that you don't get these lines that form in a static nature down the road. And then there's some very superficial light-based devices that target reds and browns in our skin, but may have some rejuvenation properties to them. Very simple, no real recovery, but there probably is some merit to doing some of those kind of things. They don't have to be done frequently, usually just a couple of times a year, but I do think that there probably is something to that prevention. It hasn't been well studied, but that generation probably is on the right track.
Okay.
As far as like what is hot, I think skin tightening devices is still very hot in the space, and there's a million of them out there. We've gone through a period now where we're using largely energy-based needling to try to tighten the skin. There's a whole big push now for coring, taking tiny little cores of the skin out, then letting the skin heal, and that causes some tightening. I think we have a long way to go, let's just say. I don't think in every case I've been overly impressed with some of the data and the publications that have been in that space. So I always caution patients about that. Nothing out there is going to replace surgery or its efficacy or come even close. So I think just be careful. These treatments are expensive. And I think you need to be very concrete with your provider or your physician about what the anticipated outcomes are. And if you can't achieve them, what is your recourse or what's the next step? So it's exciting. I love innovation. We do a lot of trials here at UT Southwestern, but I think I'm always a little bit cautious when it comes to claims of skin tightening.
Yeah. So for somebody that just really wants to get this done, wants to get filler or injections, is there a point of no return, or is there a threshold that you guys kind of warn patients about that they shouldn't exceed?
I think that's a good question. I'm not sure fillers work well for everybody. There's clearly some patients that have to have surgery. They're either so deflated or have the extent of their sagging skin is to the point now where there's really nothing that we can do to reverse that. And so I would think it would be almost a disservice to have them go down that pathway of doing injectables, including fillers. I do think being honest with your patients is important. Most patients are candidates for some of the things that we've talked about. But again, I think you want to be very specific about what you think you can achieve if you are going to do something like that. I just had a patient yesterday that asked me that same question, and she really didn't want to have anything invasive, but she really needed it. Mm-hmm. So I just said, look, I don't think you're a candidate for those. I think you're better off just not doing anything. I know that she doesn't want to have surgery, and I understand. Mm-hmm. But I don't want her to go down a pathway where she's investing a fair amount of money and just not getting anything close to what she wants to do.
No, that's actually really good.
Yeah.
And I think a lot of people are also concerned just about the downtime. There's a lot of people advertising and go in during the lunchtime and they come out looking way younger. Can you kind of just talk about what people can actually expect in terms of results?
Yeah, if it sounds too good to be true, it probably is, right? We've all heard that a million times. So I just think the more aggressive you are with a treatment, the better outcomes you're going to have, probably the more downtime you're going to need. There is a relationship between that. That's why it's good to do your homework. That's why it's good to see a couple of people before you make a big commitment like that. And more importantly, I think patients need to talk to physicians. They can go to spas and have a lot of these treatments. And I'm not saying that the providers there are not good, but I think that first discussion really needs to be with a physician. Mm-hmm. That physician who oversees that clinic or that spa or whatnot, because that's where a comfort level and a trust is established in that doctor-patient relationship. That physician may decide to delegate that to one of the staff that's there, but at least you have that interface and make sure that you you understand what the objectives of the procedure are and what the risks and benefits are.
And I would assume you would say the same thing before people would press purchase on buying like their own red light machine.
Oh my gosh, that's another hot area that you brought up. I just had a patient come in the other day that had a whole series of them. I think she had 4 of them in there, and I think it was like $10,000.
Yeah.
Again, just be careful about these outlandish claims. And if it sounds too good to be true, it probably is. I'm not sure there's tons of data on red light therapy. I know it seems to be pretty hot, and it's nice because you can do it at home. But if there's not a lot of value to it, I'm not sure how much it's going to add.
This industry has exploded about the whole Korean skincare industry. Do you think that has a lot of validity behind it?
The skincare industry is a bit challenging because it's expansive. I think there's so many options that are out there, and a lot of them don't have to undergo the regulatory process that, say, some of these more invasive treatments require, and really don't have a lot of outcomes data. And I like to tell my patients I really make my decisions for patient treatments based on evidence-based medicine and outcomes. And it's not there for a lot of that arena. So I think you have to be just careful. We like to use tried and true products that have been investigated. It's not to say they're bad. They may be great, but I think, without hard data to support it, it's just hard to know if it's really going to help patients.
Well, thank you.
Yeah, thank you.
Taking some time. If you guys have more questions, you can click the link in our bio.